Hello and welcome to Goddess Unleashed with Diane Vick. Today I'm interviewing a doctor. His name is Dr. Federico Martinez, and I'm very excited for this interview because we actually met several months ago. I work for a nonprofit. It's called Miami Family Friendly Hands, and I'm the secretary on the board of trustees. And we actually met at a presentation where I went to visit him at the university that he works at in Doral, and he was doing a presentation about autism, and everything in the presentation mirrored my life experience and how I figured out how to overcome myself. And he was talking about autism, and I was thinking more in the mindset of, yes, I have family members with autism, and I know a lot of children with autism, but also comparing it to my own health crisis and how I had overcome it, coming to the same conclusions of everything that he presented. So it was an amazing presentation. I took a gazillion pictures. I thought it was so powerful, and that's why I really wanted to interview him on the podcast so that we can go over IBS and anxiety today, but then in the future have an interview more focused on autism because it's so close to my heart, and I so love to hear what he has to say about that topic. So his name is Dr. Federico Martinez. He has an extensive background. He's a board certified physician, and then he became a functional medicine physician. He works on a board of directors in many different organizations. He works for universities. He's an amazing man, and I'll let him introduce himself now.
Hi, how are you, Diane? It is always a pleasure to be with you. And yes, we met in that presentation, and I am glad that you really enjoy it. And as you know, we learn every single day from different people that we encounter on a daily basis. Yes, I am Federico Martinez, medical doctor, licensed in the state of Florida. I'm originally from Lima, Peru, and I've been here for the past 35 years. During this time, I have gotten a lot of training in the medical field. First, I was in New York doing my residency in pediatrics and also in adolescent medicine. I became a chief resident of my program. And then I came to Florida where all my family were. And here I founded Flamingo Pediatrics. I was involved in the pediatric care for about 25 years. And then family tragedy strike me. My wife got sick with lung cancer, and so I saw, the way that she was treated with chemotherapy, radiotherapy, surgery, and so on. And she passed away about 13 years ago. And that really, really changed my life, and my family lives as well, my 3 kids. So I became a mother and a father, and I started my search for a different way of practicing medicine because I don't have a doubt in my mind that most, if not all of them, chronic diseases can be prevented. So I started my search and I found functional medicine, which actually has been a blessing. And I took all the training with the Institute for Functional Medicine. I became the certified practitioner for the Institute. And it was just announced recently that I'm going to become also a speaker for them, which is a great thing, you know what I mean? Because I will be able, especially in Latin America, I will be able to spread this knowledge of functional medicine. Like I said, it's been a blessing. It's been a blessing because now I'm able to help so many people with chronic conditions. As you know, 60 to 70% of the mortality around the world is due to chronic diseases. People don't die from acute condition, from infections, etc. They die mostly from chronic diseases. And functional medicine is the paradigm that is the correct paradigm to face this epidemic of chronic diseases.
Absolutely. Chronic disease is such a huge thing now. So many people are developing these diseases, and it's amazing to see that two aligned people, and there's so many more people that have aligned in the same way, where we started our learning, our practice in one environment for me was also pediatrics, 15 years. And then learning and growing and evolving, whether it's to help yourself or help family members. It's such a powerful journey to realize that health prevention is really where medicine needs to go. It has to be more preventative. It has to really support the patient and treat them as a whole person, which I love that you talk about that in your practice, is that it's not treating the symptom or treating the diagnosis. We're actually treating the full person, looking at everything that they're experiencing to really make a difference in their lives. I think your story was amazing, how you had to deal with this, difficult situation, your wife getting sick, and how you had to be the mom and the dad, and how you learned and evolved from that experience, which must have been super hard. But to help others in the community, you use your pain to help bring happiness and joy and health to people. So I think that's a great story.
Right, and my wife also is still my guiding force, to keep doing this.
Absolutely, we all have our purpose, and it's great to have one. And a guiding light is super important.
Right.
In your practice, have you seen any clients with symptoms that extend beyond one body system? Today we're talking about IBS specifically. Can you explain this?
Okay, first of all, I would like to make a little introduction about functional medicine. You already said something in regards to this new approach to in clinical care. As you know, we really don't have a healthcare system. We have a sick care system. People reach the physician when they have a complaint, when they have a problem. And unfortunately, most physicians, what they do is they suppress the symptoms only. They don't really dig or try to find out the root cause of these medical conditions. And that's what functional medicine comes into the scenario. As you know, we have acute diseases and chronic diseases. The system that we have at the present time is mostly directed to acute diseases. Let's say you have an urinary tract infection, you go to the doctor, he gives you an antibiotic after taking your urinalysis and your urine culture, and they give you antibiotics and you get cured. You have a appendicitis, you go to the hospital, they operate on you, they give you some antibiotics and you'll be fine. So this is an acute condition paradigm, okay? It's a very linear. But when it comes to chronic diseases, you have to take into account the fact that chronic diseases are more complex. They have sometimes many causes, and more important than that, it affects many organs and many systems. So you can imagine that one medication or two medications are not going to fix the problem. So the way that people are treated right now is that they suppress the symptoms. I see often in my practice that patients come with 10, 15 bottles of medications, one for each symptom. One for the cholesterol, one for the high blood pressure, one for anxiety, one for insomnia, one for depression. And of course, there are so many side effects associated with these medications. And sometimes you even cancel the effect of the medication when you're taking so many. And in order to prevent, for example, gastritis from all of the medication, they give you an additional medication to control the acid reflux or the gastritis, whatever. It is just a total madness in my mind. So when it comes to chronic diseases, we need to apply functional medicine. Functional medicine is the answer. Why? Because it will explore the root cause, but also is going to evaluate and optimize your operating systems, your biological operating systems. We have several systems in our body, okay? Like a car, the car has the electric system, the air conditioning system, the brake system, the injection system, and so on. By the same token, the human body has several systems, and they are connected to one another. The first system is the assimilation, everything that comes into your body through your breathing, through your skin, but mainly through your mouth and your digestive system. To me, it's one of the most important ones because that's the port of entry. Okay, we use this system every single day and several times a day. The second system is your immune system, which is just your defense and your repair system. Okay. The third system is your energy system. We all have little organelles in the cell called mitochondria. Now we know that most diseases are due to a mitochondrial dysfunction. So we pay a lot of attention to that organelle because that's what is responsible to produce cellular energy. The fourth system is your detoxification system, all the biotransformation and elimination of metabolic products and toxins that we need to eliminate, that we need to get rid of. The fifth system is your cardiometabolic, your heart, your blood vessels, your lymphatics, and so on, your metabolism, glucose, hemoglobin A1C, your liver enzymes, everything that pertains to your metabolisms and your cardiovascular system and lymphatic are in this system. The sixth system is your communication, how the cells communicate to one another through hormones and through neurotransmitters. Very important. Gotta be a balance there. Otherwise, we're gonna get sick. And the seventh system is your structural integrity, from your cell membranes to your muscles, to your bones, hair, skin, everything that constitutes your structure of the body. So when functional medicine, what we do is we evaluate and we optimize these several biological systems. In this way, we create balance and we create wellness. Of course, we take into account all the lifestyles. You know, we're going to be talking about that later, about the lifestyle, which is sleep, nutrition, exercise, stress, and your relationships. At the same time, you know, we explore also your mental, your emotional, and your areas. All of these factors come into the equation in order to create balance and wellness. So that's functional medicine. It's not holistic medicine. It's not alternative medicine. It's no herbal medicine. It's just a different approach. It's the way that you see the patient differently. You have a different GPS, a different chip to evaluate your patient with Crohn's. You also do a lot of prevention with this functional medicine. You treat patients with other conditions, and you reverse medical conditions. At the same time, you increase longevity as well. And I have a perfect example is my mother, who is now 100 years old, and she is the best testimony that I have because she is a functional medicine patient. She's my patient, my own mother. And she is in perfect conditions, and she's 100 years old now. So, you know, of course, she went through a lot of medical problems in the past. At some point, she was even given 1 year to live. This was like 15 years ago, 1 year to live by 4 doctors. And now she is in perfect condition because of functional medicine. We optimize her operating systems, and she has very good memory, very good concentration. She's very energetic. She does her own things, and she's 100 years old. So hopefully, all my patients will reach that age if they follow, of course, all the guidelines and the directions of functional medicine.
That's amazing. Yeah, definitely. We have to look at the whole person, the whole body. And it's so amazing that you look into all the body systems. I help people a little bit differently because I don't have the lab tests or anything like that. I go by their medical history and what's going on with them and incorporate supplementation, nutrition, and lifestyle changes into their routine so that then they can deal with stress and inflammation within the body. And I have seen that there are many clients that experience symptoms that extend beyond the digestive tract, beyond just IBS. I'm prime example of that. I know in our last conversation, hair loss was like one of the first signs that I started at 15 years old, and my doctors completely disregarded it as nothing. And I told them I have a nutritional deficiency. There has to be something wrong with my digestive tract, because I know, one, I didn't eat well. Two, I knew that I wasn't getting the right kinds of foods, like fruits and vegetables, and I was eating too much junk, which had too much sugar. Can you explain a little bit more about these extra intestinal symptoms, in addition to the hair loss that we talked about the other day?
Sure. I mean, I see in clinical practice when they come with, let's say, with IBS, with irritable bowel syndrome, and I see that those patients, they usually complain of other systems that are compromised. For example, they see people who have red eyelids, they have itchy ears, they have stuffy nose, sinus problems. They also have sneezing attacks. You know, I see a lot of people with that. Chronic cough is another one. And of course, acne, hives, hair loss, even excessive sweating. I see people with excessive sweating that comes with intestinal symptoms. Irregular heartbeat, that's another one. People who even come at early age with high blood pressure, you know, and they are already medication. I have one patient who is a 27-year-old with high blood pressure. Right now, he is off the medication because we optimize the digestive tract, and that was probably one of the reasons, and we will explain why that happened. Asthma, that's another one, shortness of breath, and of course, pain in joints. Joint pain is a big thing, you know, stiffness, limitation of movement, excessive weight, compulsive eating, water retention. I mean, we see that often. The other thing is that they usually complain that they're very fatigued, they're very tired, okay, sluggish. As far as the memory, poor concentration. They also sometimes they have stuttering. I see people with gastrointestinal. Actually, a very close relative was diagnosed. I diagnosed with leaky gut, which we're going to explain in a little bit, with increased stuttering and symptoms of IBS. The other area that is very related to this IBS is mood swings, anxiety, depression, aggressiveness, anger, irritability, and in general, they just become more frequently ill. They are always ill. They have, with a lot of colds, with a lot of conditions like this, they have a genital itch sometimes, frequent urination, you know, that kind of thing. So yes, there's a variety of extraintestinal systems and symptoms that are frequently seen in this patient with IBS.
Absolutely. It's so amazing how everything you say aligns with my entire experience. So I had the majority of those symptoms that you talked about. I was always on antibiotics for UTI infections, on treatments for yeast infections, sinus infections. I had severe reflux. I also had orthostatic hypotension and fainting episodes because my blood pressure wasn't regulating well. And it's all started for me with changing my diet. So I worked on eliminating foods that created sensitivities and allergies within my body. And I found that that also aligns with a lot of my clients. And we start off with the elimination diet, and the 5 trigger foods that I've identified on my journey and through research was corn, dairy, artificial sweeteners, sugar, and gluten, and how it impacts the body in many ways. And you can get symptoms. One of them was, a big one was fatigue and bloating and weight gain with gluten for me. And once I eliminated that, those symptoms slowly started to disappear as my body started to heal and remove these toxins. What have you seen in relation to these 5 inflammatory foods or other food sensitivities in your patients?
By all means, those are probably the most prominent type of food that are related to this type of content. Once you do the elimination diet, and I will add probably there some peanuts, and I will add also um, uh, shellfish. Shellfish and peanuts, along with corn, with gluten, with processed foods in general, excessive sugar, um, for example, the sugary drinks that are so commonly used right now. In addition to the eggs, eggs, and of course milk and dairy products. Those are very offensive type of foods, But sugar, by all means, is sugar and gluten probably are top on the list. And I have seen that when I do this type of elimination diet, even if I don't know the results of the food sensitivity, because as you know nowadays we have laboratories that perform a very, very precise type of food sensitivities. And let me explain to you there what usually we're looking for. We're looking for not only the allergy part, because as you know, the allergy part is mediated by immunoglobulin E. Okay, this is the allergic part, immediate reaction. We are looking for more the IgG reaction. It's an immunoglobulin G responsible for the delay sensitivity reaction. So we have the allergic reaction, we have the sensitivity reaction, and then we have the intolerance reaction. Intolerance is when you lack an enzyme, typically lactase deficiency, then you have intolerance to lactose. But that's different. That is not mediated by the immune system. The other one is mediated by the immune system, the IgG reaction. So when we do this testing, we also are looking for the complement reaction, which is another arm of the immune system that indicates that the reaction is even worse. So, but even before we do this testing, I automatically eliminate corn, as you mentioned, sugar, processed foods, shellfish, gluten, peanuts, milk, eggs, and that's basically what we do. Immediately, these patients start feeling better. Immediately, okay. And once we get the results, of course, we will eliminate the other ones that became positive. But yes, it's very, very frequent to see that.
It's amazing how we came up with the same list. And peanuts was also one of the first ones that I eliminated from me. I had realized that I kept getting these acne on my face, and then I would get other symptoms related. And as soon as I eliminated it from my diet, I no longer had to go to the dermatologist for all these unneeded injections because that completely went away. Right. So it's so powerful just to start with diet. We only have about 1 minute left, and then we're going to go on break. What would you say, in short, would be the most effective treatment that you've had for IBS?
Okay, well, the IBS, the first one is change your diet. Is nutrition. The nutrition change is probably the single most important one. Of course, I try always to also tell people, for example, the stress management, try to do a little more exercise, try to control a little more try to normalize your sleep and so on. But by all means, nutrition is the number one. I will change nutrition right away. Doing not only elimination diet, but also trying to eat more vegetables and fruits. That change is the single most important one that will help them right away. Now, of course, in my medical practice, we do a number of testing. We do the food sensitivity. We do the stool testing to take a look at the microbiome. We also have a testing now for the intestinal barrier, okay? And with that information, I will be able to install a more advanced treatment. That treatment is basically the 5R treatment. 5R means remove all the foods that are offending your intestine. Remove all the bacteria, bad bacteria that you have in your intestine. And the number 2 is replace. We're going to replace things that you don't have, for example, pancreatic enzymes, fiber. You replace the gastric acid. The third R is your re-inoculation. We re-inoculate with probiotics, okay? And the fourth is your restore your intestine. Restore with L-glutamine, with arabinolactone, with licorice, and so on. And the last R is rebalance. Rebalance with trying to work a little more on the stress at the stress level. Try to teach the patient how to overcome, because we all have a stress, but overcome the effects of the stress on our, for example, meditation, a little more yoga and things like that. I mean, with that strategy, usually people respond very, very well.
Yeah, that's beautifully said. Nutrition is like the biggest component of my program, and that's where the book starts. So I wrote the book, The Truth About IBS and Anxiety. It's actually live on Amazon as soon as this episode releases. And the foundation of everything is supplementation and eating the right food and eliminating those inflammatory foods. And stress is such a huge part of it. But what I've found is a lot of the clients out there with IBS don't want to hear, just like I didn't want to hear, that stress was a big problem with the symptoms. And that's what I teach. I teach people how to relax, how to develop a routine for their lifestyle that's not hard, that's very easy and effortless, but incorporates a lot of that meditation, hypnosis, stretching, exercise, all of these beautiful things. So we're going to go on a few minutes of a break. And when we come back, we're going to talk a little bit deeper about thyroid disease, connecting the digestive tract with leaky gut and other symptoms in the body. And see you soon after the break.
Excellent. Thank you.
All right. So welcome back. Before we left, we were talking about IBS and the typical treatments. And Dr. Federico Martinez was talking about how many R's is it? 5 R's?
Yes, 5 R's.
Amazing. And our practices align.
Remove, replace, re-inoculate, restore, and rebalance.
Amazing. And the foundation of everything is nutrition. So we align so well. Mm-hmm. In your expertise, what other body systems does IBS impact? I know you covered the systems already. What have you seen?
Well, yes, nasal and sinuses very frequently are affected. The IBS, and by IBS, I also mean that we're going to be talking about leaky gut. I'll explain what is leaky gut, but they're usually associated. And the other system is the adrenals, the adrenal glands. Many people who have, as I mentioned before, they have fatigue, adrenal fatigue, some sort of, or some degree of adrenal fatigue. They, in general, the colon has a lot of problems in the colon. The diarrhea, constipation, abdominal pain, belching, and so on. Then the thyroid. Thyroid is also affected. Usually we see people with an autoimmune condition, Hashimoto's, for example, Hashimoto disease. In addition to that, patients usually have also emotional problems. They have anxiety, they have depression. Some people even call leaky brain. Now they're talking about leaky brain because they have mental fogging. They have, they have this fogging that they that don't allow to think straight or think well or make decisions properly. And in general, I think the IBS and the leaky gut or / leaky gut affects many systems of your body. So don't think that this is going to affect only your intestine. You are not going to have only intestinal problems. So you're going to have also problems in all of these areas. The skin is also affected with eczema, with hives, and of course, hair loss, as we mentioned before.
Absolutely amazing. I also experienced that in my journey was the thyroid. So you talked about Hashimoto's thyroiditis. In my case, every time that I went to a doctor over my health span, which was huge. I mean, my medical files were encyclopedias. They were so big. every time that they would look at me, just by looking at me, my eyes have decreased significantly, but they used to bulge out. And it's like a family history thing. Like everybody has this in their history. My mom ended up having her thyroid removed. I've had nodules, which they found incidentally on an MRI looking at my neck. And then I had to monitor my thyroid all of these years for about 10, 15 years. I didn't have any fluctuations in the levels, but it was still a concern that they've been monitoring. So it's amazing that you see the same things, these other body systems that are being impacted by the IBS. Can you talk a little bit deeper about the thyroid conditions and the connection with digestive issues?
Sure. We have to understand that 85% of the immune system resides in your intestine. So in order to have a very competent, strong immune system, you gotta have a healthy gut, a healthy intestine. Not only structurally, but also what is in it. You have to have good digestion, good absorption, good elimination. The status of your microbiome, which is your intestinal flora, has to be also very, very balanced. Your gut diversity, the community of the germs in your intestine, has to be good. So, having said that, when you have IBS, you have intestinal problems like leaky gut, what happens is that there is a separation of the cells of the lining of this intestine that allows the filtration of products like gluten, food particles, toxins, bacteria, and of course, whatever medication you're taking as well. And that goes into the bloodstream and stimulates the immune system. When it comes to gluten, for example, the gluten has so many proteins in it. It's not just gluten. It has, for example, gliadin, it has glutenin, it has different types of proteins. So you develop antibodies against these different proteins in the gluten. So now when you have a rise in your bloodstream of these antibodies, just because there is an immunological mimicry with your thyroid tissues, then those antibodies not only attack the gluten and its constituents or the components, but also start attacking your thyroid. So what happens is that there is an inflammatory process that happens in your thyroid. It's called thyroiditis, autoimmune thyroiditis. And Dr. Hashimoto described this condition very, very well, and that's why he bears his name. In Hashimoto, typically you have an increase in the peroxidase, anti-peroxidase antibodies, or you have also increase in the thyroglobulin antibodies. And now we are able to measure those. In addition to that, you will produce less amount of thyroid. As you know, the thyroid produces T1, T2, T3, which is the metabolically active thyroid hormone, T4, which is the prohormone, and also calcitonin, 5 hormones. So if your thyroid is being attacked by these antibodies, you are not going to produce these hormones. Therefore, they will go down, and your TSH, the thyroid stimulant hormone coming from your pituitary gland, will go up, trying to stimulate and stimulate and stimulate. So the pituitary gland senses that there is no thyroid hormone, therefore increase the TSH. That's why typically you see in the blood test, the TSH is very high, but your hormones are low, especially T4 and T3. The treatment, of course, is to replace these hormones. What are the symptoms? Typically, people feel very fatigued, very slow, sluggish, the mental fogging. Okay, in the physical exam, you see people that they have a hard time to lose weight. Also, the deep tendon reflexes go down. They are very slow. The voice, deep and also very slow. They say that this is the only disease that you can diagnose over the phone, because typically the patient speaks very slow on the phone. So you can actually make the diagnosis over the phone of hypothyroidism. So the treatment, of course, is to replace this deficiency in your thyroid hormones by a combination of T4 and T3. Now, typically, doctors, conventional physicians, they give you just T4, which is the levothyroxine under the name of Synthroid. But that only contains T4, which I don't think is a good idea to give, because what happens if you are a very slow converter? You're supposed to convert T4 into T3. Remember, T4 is a prohormone. The actual metabolically active thyroid hormone is T3, and that conversion happens at the cellular level. So if you just have T4 and under several conditions you are not converting into T3, that medication is not going to help you. So it's better to give a combination of T4 and T3, and this comes under the name of natural thyroid hormone, usually of porcine origin. And in this way, you make sure that you're given both T4 and T3. My patients who are on this medication, they feel very well almost immediately, because you are replacing the right type of hormones. But in addition to the medication, you of course tell them to do other maneuvers, especially a gluten-free diet. It's very important, because what you want to do is you want to reduce the attack by these antibodies by reducing the production of these antibodies in the intestine. That's why you give a gluten-free diet. When I do the food sensitivity testing, I also add the other food that the patient is sensitive to. In this way we help them quicker. Okay. Usually these patients, they respond right away to the therapy. And I have to tell you one thing in regards to the gluten-free diet. I often tell my patients, do not buy anything that says gluten-free. And they say, why do you say that? Because those products are processed foods, and they contain a lot of junk. They contain a lot of sugar. They contain a lot of preservatives, a lot of chemicals that are going to produce also a lot of damage in your day. I mean, they are gluten-free, but they have also a lot of problems, a lot of other things. So in this way, I tell them to eat mostly whole foods, fresh whole foods. That there are certain foods that, for example, vegetables, they usually don't have gluten, they natural ones. Quinoa, for example, they are gluten-free. I mean, this is protein, gluten-free, less carbohydrates, is one of the perfect type of what we call the superfoods. So it's just to give you an example of how we approach Hashimoto's disease, thyroid conditions associated with intestine, because again, remember, 85% of your immune system resides in your intestine. One more thing is that once you develop one autoimmune condition, the conditions are set to develop a second or a third or a fourth autoimmune condition. So I see some patients that come to my office that had Hashimoto years ago. Nothing was done in regards to nutrition. They were just given Synthroid. And now they come with rheumatoid arthritis, or they come with lupus, or they come with multiple sclerosis. And they started as a Hashimoto. So it's very important when you see one autoimmune condition is to intervene properly with all of these functional medicine principles in order to avoid for them not to get worse only from the Hashimoto, but also to prevent the development of other autoimmune conditions.
Absolutely amazing explanation for that. And I have seen that with clients and seen it through my own life experience, how our diet impacts us. And yes, gluten-free does not mean that it's something that you should be eating all the time. And I tell my clients that all the time. If it's boxed, if it's been processed, it's something that you should use very limited. You should be cooking your own food and really focusing on natural, healthy food products that are coming from the earth, the fruits, the vegetables, and everything that you can buy fresh in the grocery store. Exactly. So I love that you talk about that. The big thing that I found in my own health journey was that stress and inflammation, what was causing the disease. And my disease all started with leaky gut, and then progressively started impacting the joints, and I had severe body pains, fatigue. It just impacted my entire body. The way that I was able to tackle that inflammation and how I help my clients is using a product that actually has 5 herbs that help reduce the inflammation in the body and target that cellular stress and damage by detoxifying the body and helping it clean itself every single day, because we're exposed to free radicals and toxins from the air we breathe, the food we eat, and everything that we're exposed to. And that was the crucial turning point for me, starting with nutrition, tackling that detoxifying factor, and really dealing with the stress and inflammation. What are some tips that you have to target that stress inflammation? I know we've covered a lot already. Anything else that we haven't talked about yet?
Well, yeah, no, I think that the microbiome is something that we haven't talked about too much. And we have about 100 trillion bacteria in our intestines, which represent about 3 pounds of bacteria. A forgotten organ. For many years, we talk about the heart, the liver, the kidneys, the brain, but we never talk about a 3-pound organ, metabolically active, that actually is involved in every single metabolic process in your body. Controls you, even your weight and your hunger, controls your behavior, your emotions. This microbiome. 3 pounds of bacteria living in your large intestine. When the scientists starting to explore the human genome, all the genes that we carry, they were surprised that of all the millions of genes that we have, there were only 20,000 human genes. The rest were bacterial. And there is a wonderful book about that. You know what is the name of the book? It's 10% human, 90% bacterial. That's what we are. We are mostly bacterial. So this 100 trillion bacteria, they live in the large intestine. The small intestine doesn't have too many bacteria. As a matter of fact, when you have a condition called SIBO, a small intestine bacterial overgrowth, is because something has happened, inflammation, stress, as you mentioned. Remember, stress is very inflammatory. Or medication, surgery, anything that will injure your intestine. Some of these bacteria travel and colonize the small intestine. And then when you eat something, you have a very premature fermentation and you have bloating right away. So that's a condition called a small intestine bacterial overgrowth, which I'm seeing more and more in my clinical practice. So what other things are happening in this microbiome? The neurotransmitters. We used to think that the neurotransmitters are produced in your brain or your nerve system, but in great amounts, some of the neurotransmitters that are crucial are produced in your intestinal, by your intestinal flora. For example, serotonin. 85% of the serotonin is produced by your intestinal bacteria. This is something that many people don't know. We have several neurotransmitters. We have the inhibitors and we have the stimulants. The inhibitors are usually serotonin, GABA, and glycine. The stimulants are epinephrine, norepinephrine, glutamate, dopamine, histamine. So in order for you to feel good and to perform properly, you need to have a balance of these inhibitors and these stimulants. So what happens when you have a problem in your intestine, like IBS, like leaky gut, you have your gut diversity is no problem, you are not going to produce, let's say, serotonin, which is inhibitor, is the brake. So the other ones will predominate, the stimulants. What's going to happen? Anxiety, insomnia, high blood pressure, and so on. Because you have too much of the stimulants, less of the brakes of the inhibitors. So when you optimize and you balance this microbiome with all of these treatments, these people start feeling better almost immediately. I have been able to get patients off medications like the typical anxiety medications, anxiolytics. I had one patient with bipolar disorder. Amazingly, once we balanced his system, this is the son of a very close friend of mine who was going through a difficult time with all of these problems, plus the medications. He couldn't control himself. And now he's off the medication and he's doing very well. Actually, he went back to his wife. They were ready to get divorced because of his behavior. And now he's doing much better. So my question is, how many of these mental diseases are in great portion, great part, intestinal diseases?
I believe a lot of them, huge
Exactly.
amounts, because I experience the same thing, the anxiety, and most of my clients that come to me have a combination of digestive and anxiety or some kind of depression. There's always some kind of mental component. And it's amazing that you talk about the importance of the microbiome, because that's one of the things that I talk about in the book, how important it is for us to take probiotics to really build up that flora, because that's our immune system starts in our digestive tract. I know on the last conversation we had, 80% of it is, as our immune system is there in our gut, and it's the foundation for our entire body to work properly. So it's so amazing that you talk about probiotics, because a lot of people think that, oh, whatever, not a big deal, I don't need to take it, my body has enough bacteria. But really, we need a good balance so that we can process our food and remove toxins and our body to function the way it was designed.
Exactly. Yes, very important.
We have a couple more questions before we end. We have about 4 minutes left. What are some of your significant lifestyle tips? So I talk about lifestyle and incorporating different stress management techniques in the book, and there's many different variables. And we did talk about on our call before how sleep is so important. So the things that I incorporate help them achieve sleep, deeper sleep, and relax the body during the day. What are some lifestyle tips that you have?
Well, I think that, again, one of the most important ones, or the most important one, is nutrition. The lifestyles, modifiable lifestyles, nutrition. We have to make every effort to educate patients about nutrition. It's not just telling them eat more vegetables and fruits. No, it's not that. It's also to teach them how to prepare them. Sometimes I even have my son who is he does integrative nutrition. He goes with my patients to the store, to Whole Foods, and teach and educate them, what kind of foods to pick up, what kind of foods they need to incorporate into the diet. So it's education. How to prepare is very important, because you can't just tell the patients or people to eat more of this or that. Is to teach them what you're going, how is going to be your breakfast now, how is going to be your lunch, how is to be your dinner. I even have a chef, a functional chef, for people who are interested. And I know the first 90 days are crucial in the therapy, because food is medicine, as you know. Food is medicine, and medicine is food. So when you tell them, you need to do this, but I know that you're going to need some help, then this functional chef gets the information, of course, with assigned consent, about the food sensitivities and about the condition, and he prepares the food and he delivers the breakfast, lunch, and dinner to my patient for 90 days. That's when I really see the big difference, because I don't trust sometimes the capacity of the patients to create this type of diet change. I need to have somebody that not only will guide them, let's say my functional nutrition, which is another lady who is here with me, but also is a chef that will prepare the food for these people for the first 90 days, which are, to me, are vital and crucial. I think with that we make it. This is just to tell you how important is nutrition, and the elimination of processed foods, and the elimination of all of these foods that create a lot of addiction, like sugar, high fructose corn syrup, which is everywhere. So they need to have an education, very solid education about this. Sleep is the second one, is sleep hygiene. We teach them that do not use your cell phone after a certain time, because the light of the cell phone or the tablet, not too much of the television, because you can actually watch TV and fall asleep, but the light of your cell phone and your tablet will actually affect the production of melatonin, of natural melatonin, and then you're going to have an obstacle to your sleep. So sleep hygiene. There's so many things, but I think that's one of the most common ones that I tell patients. They have to sleep probably 7 to 8 times. Sleep hygiene. Exercise. At least 3 times a week. We basically says you have to do maybe an hour every day if you want to do it every day. But you got to have some sort of exercise, not only to lose weight, not only to keep your muscles in shape, but also to create certain hormones and certain products in your brain. For example, the neurotrophic factor that is very important to prevent certain neurodegenerative conditions. Stress. We all have stress, but we have to learn ways how to deal with it. For example, as I mentioned, meditation is one of them. Practice this on a daily basis. Yoga, if you can do that, if you can afford that, please do it. And you have to learn. Now with YouTube, we have a great help, because you can learn a lot of things, a lot of techniques. The other one that I use a lot also is the emotional freedom technique, EFT. Emotional freedom technique is the acupressure in certain areas in your body in order to interrupt the recirculation of the emotions. Emotional freedom technique, very important. Also in YouTube, you have a very good explanation about how to do it. Your relationships, you have to work on your relationships, and you have to actually identify what we call the emotional vampires, people who come, toxic people, stay away from them, try to work in that regard, because in that direction, because there are emotional vampires that actually will absorb all of your energy, and that's not a good thing. So those are the modifiable lifestyles: mental, spiritual, and emotional areas. You have to work on those. That's part of the equation too. Mm-hmm.
Amazing explanation. And I work with my clients on all of those things. And I think it's great that you have people that help teach them about diet and nutrition, because that's some of the stuff that I've worked with a nutritionist to create a program that really supports my clients, and actually, showing them that I live this experience, and I videotape and create recipes and help support them in the process, because I know how hard it is to change your lifestyle and to develop, these new techniques for yourself. But it doesn't really have to be that hard as long as you have the right support. We are out of time, so I wanted to give you some time to give a little closing. Where can they reach you? We're going to have all your information on the website as well, but just so you can say goodbye. Thank you for meeting me on this podcast. I can't wait to bring you back again.
Diane, it's been really a pleasure. I'm always happy to be in your program. I really appreciate also the opportunity to spread the beauty of this approach, which is functional medicine. We have to see chronic diseases not only as an epidemic, but also as a tsunami, because it's killing so many people. And what is more important is that all of these chronic diseases are preventable by doing these changes. So um, I feel blessed. I feel blessed that I can practice this type of medicine. Of course, it took me many years to, to get my training and to develop expertise in this field. But I feel blessed that I will be able to help a lot of people. For people who are interested in seeing me, I'm Dr. Federico Martinez. My practice is Health Park Medical Center. Again, it's Health Park Medical Center. We have 3 locations, one in North Miami Beach by Sunny Isles. We have another one in Weston, and then another one in Boca Raton. My phone number, the main phone number is 786-345-1516. Again, it's 786-345-1516. And I will be more than happy to help you with any kind of concerns that you may have. Thank you so much again for this opportunity today.
Thank you for being on the episode, and thank you everyone for listening. Stay tuned for the next episode. Have a beautiful day.